Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm Shawn Needham, along with my wonderful wife, Janet, and we are super excited to have Dr. Renata Moon back on our show today. She's going to be talking about medical education and differential diagnosis. While we're waiting on getting her on, one thing I want to kind of make a prelude to is that there's some sad things going on in medicine right now. Lots of sad things. And one of them is, if you notice, sometimes when you go into some clinics, they'll have you fill out a form and they'll ask you about your gender. And they have more than just male and female gender on there. And we're going to be talking about this because this is being taught in medical school now. Now, here's what my question is. If you have a doctor or somebody in healthcare that has to ask what your gender is, do you really want them taking care of you? Serious. That's a serious question. Janet, what is your comment on that?
So I think when we get into the role of taking care of patients, a person's gender is important. It's important how to diagnose something. It's important how to prescribe a particular intervention, whether it be a pharmaceutical or a hormone or type of therapy. There's differences, and we need to recognize that. It's not a political thing. It's
No.
not a social, personal thing out there. It's just a basic fact that we need to address and prescribe and take care of somebody based on somebody's sex.
And it's black and white. It's
Right.
male or female. And let's give an example, since Janet and I mostly deal with hormones. Let's give an example. If your doctor doesn't know your gender and they are starting you on hormone replacement therapy, if you're a woman, a biological woman, do you want a male testosterone dose?
Absolutely not.
Right, which is 50 to 100 times more than what a woman's is? Absolutely, you do not.
Right. Because the consequences are significant when we're talking about overdosing, especially with hormones. A female dose is 100-fold less than a male dose. And so what would occur is not very helpful. And the other thing too is that it's not about any judgment or it's just what is appropriate and what is not appropriate and what is the best outcome for this person.
Well, and let's talk about some other things when it comes to a gender role. What if a female of childbearing age is having belly pain? You can't rule out pregnancy, right? But if that was a man, you can,
Right.
and it could be appendicitis or
Right.
what have you. So there's certain things that it's very, very important. Obviously, I know this seems obvious, but it's amazing we have to talk about it.
Right.
And Dr. Moon is going to, when she gets on, she's
Right.
going to expand on this.
Well, to expand on that, if I had a young teenage girl in the OR and she's having some pain, I don't care what you put down on that piece of paper. I better rule out that she's not pregnant, or if she is pregnant, we need to address the problem because internal bleeding. I mean, there's all kinds of consequences if you don't treat it appropriately. So, I struggle with the silliness of not being just straightforward. I personally don't have an opinion to say whether you choose to label yourself anyway, but when it comes down to your health, it is important. And like Shawn said, appendicitis. So I'll throw my oldest son in there. He had to have a surgery when he was a very young child, and he had an intestinal resection. And it was super important when they did the surgery that the pediatric surgeon took out his appendix, because the scar would look like his appendix was removed. And if you went into the OR and you were having a surgery or you were having pain, and it could be overlooked. And so we didn't want that ever to happen to him because it could be a medical emergency. So there are things that we do in medicine to prevent problems later down the road. And to me, that made perfect sense. So I think, we have jumped in the last at least the last 2 years on a agenda platform for many patients, and I struggle with this. And I'm going to give you an example of what's super important for, like, let's say an elderly woman, and especially as we age for women, we need to take care of our bones. And so Shawn talked to us about the dose of testosterone. And yes, I do recommend dosing women with testosterone to help healthy bones, but I would never give them a male dose. And especially when we're looking at what kind of response we want. And so the appropriateness of a dose really is put at what someone's age is, what somebody's results are going to be, and what kind of biological DNA they really carry in their body as male or female.
Yeah, that is totally true. And as we work on getting Dr. Renata Moon on here, she is going to talk about how this is actually coming down in our medical schools. And there are certain things the medical schools are telling doctors to do, or young doctors or young future doctors. And one of the things that they're telling them to do is they can't ask about somebody's sex. They have to ask what kind of pronouns they want to use before they can take care of them. And that, I think, is just ridiculous, because it's not about how you feel today. It's about how, and if you feel like you're male or female, that's not how something's going to work in your system and how a doctor can appropriately treat you. They need to know biologically how you were born, and they can do that by looking at you. It's usually fairly obvious. Janet?
Yeah, I mean, we don't do this when we go to having our pets go to a veterinarian to decide what kind of appropriate therapy. So to me, I think it's a political agenda. It's unfortunate, but we put providers in a very sad position when we're having to do these kind of things.
Dr. Renata Moon, welcome back to our show.
Welcome. Thank you.
And we were just discussing how you, on our last podcast, you kind of talked a little bit about this, about how in medical schools they're talking about how one of the things is that future doctors are supposed to ask patients is what they want their pronouns before they can take care of them. And we wanted you to expand on that and how important it is. One of the things that we also talked about was that, if your doctor doesn't know whether you're a male or a female, do you want your doctor taking care of you? I mean, that's a serious question. So those questionnaires that clinics have you fill out about, how you identify, I mean, do you really want to go to a doctor that can't identify you as a male or female? You go.
Yeah, I think the emphasis has been on, making sure everyone's comfortable in the healthcare setting, right? So the initial idea that we should ask everyone their pronouns, I think honestly started in a kind way. It started because they wanted to make sure that people who identify as transgender felt comfortable. But the trouble is that, the vast majority of the people out there don't, don't identify as transgender. And so when someone walks in and immediately asks everyone what their pronouns are, it can be very off-putting for many patients, and I think concerning for many patients. And so I think we've morphed into a world where we're trying to provide comfort for a few at the expense of many, right? The trust of many in the system.
Yeah, absolutely.
Yeah.
And I just think, and it's coming from the medical schools now, correct?
Yeah, the medical schools around the country are very much teaching students to, as they walk into the room, to identify or to ask the patient what pronoun they identify with. And again, for a variety of reasons, that's not necessarily going to help the vast majority of the patients that they see feel comfortable about the healthcare, they're about to receive. So,
Well, and is it true that, in the past, and I know this is not going to sound very good to some people, but is it true in the past if there was a biological male that came to you as a doctor and they identified as a female, is it true in the past that you might refer them for a psychological evaluation or psychiatrist? Is that a valid question?
yeah, in the past, you mean like more than 2 or 3 years ago?
Yeah, exactly. Right.
Yeah, I know. The last 3 years, I forgot to start with my disclaimer, which is that my views here are my own. I'm not here representing any other entity. or anybody else. But just a few years ago, hasn't the world just turned on its head with everything here? So just a few years ago, if you came in and you had concerns that you were something that you were not, we had worries about your mental health, right? And instead now it's morphed into a whole world that I don't think many of us recognize any longer. In my world of pediatrics, what I'm most alarmed about are how young the children are whose parents are bringing them in, and who tell us that they are gender confirming their children or affirming them in the opposite gender. So meaning I've seen kids as young as 3 and 4 years old come into my office with parents who are telling me that the child is the opposite gender. And they're so young, they're not making their own decisions at that age at all. This is, and a few years ago, 5 years ago, if that had happened, I would have reported that parent for, emotional child abuse. Today we're expected in many clinics to refer that parent and that child on to a gender affirming center. It's become this world where it reminds me a lot of the Alice in Wonderland stories or the Twilight Zone. It really has. How can a parent of a 3 and 4-year-old possibly justify? I've had them look at me, the parents look at me and say, "Don't worry, Dr. Moon, my child has made up their own mind." And this is a 4-year-old. This is a
Right.
4-year-old. This 4-year-old, or if I'm examining a 6-year-old or an 8-year-old in the office, they often will start to bark like a puppy, or they'll stand on one leg and they'll squawk and they'll tell me they're a flamingo. I mean, they don't know. They're busy with their imaginations. They're busy having a wonderful childhood, and yet these really young children have parents telling them that they are something that they are not. So it's really a unique situation now.
Well, and I think in Washington State, and since you are a resident of Washington State, I think there's some law just passed that um, th- kids can basically do this on their own without parental consent, and there's nothing that doctors can do to stop it. Did you know about that at all? Am I putting you on the spot?
No, you're not putting me on the spot at all. Yes, I have. I'm horrified by it. So it's this idea that you no longer really make medical decisions for your child, that increasingly the government and the state will make those medical decisions for you, even when they are outrageous and just terrible in terms of what may happen to your child. So picture this: your beautiful child comes home one day from school, and the school has taught them that they are the opposite gender, and now they want puberty blockers and they want surgery that is permanent. These are permanent actions on their bodies. And you, as a parent, will no longer have the ability to say, "Whoa, wait a minute, what's going on here? I want to talk to my child about this. I want to figure this out together." Your parent rights, your parenting rights will be taken away according to these laws that are being suggested, and in many cases attempted to be passed in states. So you're losing your parental rights for something as
That's kind
horrific.
of frightening.
It's extraordinarily frightening. I don't think the word frightening even does it justice. We need to create an entirely new word for the horror of this. But this is what we see in these types of communist systems. Again, my parents fled from communism, and my mother, when she was a young student in her communist-run school system, was repeatedly injected with whatever they were injecting the children with. And she would come home, and she remembers one time the area that they had injected her in her shoulder it just looked like it was getting infected. And her parents, my grandparents, were talking amongst themselves, and she heard them saying, "Oh, I wonder what they gave her. I wonder what they gave her." And this was their own child in the communist system, where the government took over all parenting, medical decision making. This is what we're heading into. And we really are. It's happened before, and it's happening again in front of our eyes.
Well, yeah. I mean, you could make a very valid argument that with all the mandates that they have over the last 3 years with certain vaccines, that it was happening before our eyes.
Yeah.
And what really, you asked the question, what were they injecting her with? I mean, as a pharmacist, I really wonder what was in those vaccines. And, there's lots of talk about the batches not being consistent from batch to batch. And so what all was in there? I mean, I think that's a valid question. So we are living this. This
We
is
are.
this is the communism that your parents escaped from.
Yes. I mean, I went to the Washington, D.C. Senator Johnson hearing on my personal time off to testify about my concerns about that. I had found a box. I had never ordered shots for any patient at all, ever. But I finally had my hands on a box of the product, and I'd heard that the package insert was blank. And I did. I went to a sealed box of this mRNA product. I opened it. I pulled out the package insert, and it said on it, on both sides, only the words intentionally blank is what it said. Nothing else. So how do you know what's in the vial that's in that box that you're about to inject into a child if you were to do that? You don't know. So literally they are agreeing with you. They're putting a package insert into the box that tells you nothing. And people say, well, there was a QR code on it. I scanned that QR code. It said product not found. I have a photo of the screenshot of that. So looking on a website to see what they say is in the box is not something that is even true. We don't know what's in that vial. The package insert is supposed to tell you what is in that particular vial in that box. So your words are absolutely correct. We don't know. Right.
Yeah. Well, and honestly, I've lost so much faith. Jan and I are both pharmacists. And by the way, I forgot to introduce you, my wonderful wife, Janet, Dr. Moon.
Hello.
And you will get to see her in a couple months at our Medical Freedom Conference. So thank you for speaking there. I mean, I wouldn't trust if they wrote down what was in there. I mean, seriously, I have lost so much faith in big pharma that I don't trust them at all. I mean, it's just hard not to question all of it.
Yeah. Yeah. No, I don't disagree with you. Our faith in the system and all the regulatory agencies, all the agencies that we all trusted for our entire careers, our faith has just disappeared in them. Our trust.
So while we were waiting for you, we were talking about this, and from a pharmacist point of view, I just feel very strongly that it's super important for whoever is providing medical care to have all the answers they can have. Because if, for say, you are treating a female, and I'm sure this happens, a young girl, a teenage girl, and she's pregnant, and she identifies as a boy, what could happen to this individual without all the knowledge could be very frightening, in my opinion. So how you treat someone, isn't it in your mind as a physician or as a pediatrician to know everything you can about that patient?
Yeah, of course we want to know that. And, we want to be as kind as we can to patients and understand. Of course, all those things are true. We need to know what anatomic body parts they have, whether they identify as male or female, we need to know what organs they have inside of them, right? To understand, I'm not going to diagnose testicular torsion on a female patient,
right,
unless this is someone who is a transgender female who is biologically male, right? So we have to know this information. But the questioning has become, it's just gone too far. As we try to incorporate the very few people that were actually transgender in our society, as we try to incorporate them into our regular world and be kind to them and do all the things that we want to see happen in a kind and loving society, we've gone too far. We are teaching children as young as 4 and 5 years of age that they have a choice in their gender, and they really, in fact, don't. The mental health consequences of going down the transgender pathway are huge. And we're instilling in them a lot of problems if we tell them things that they're not. We should be building them up. You're a lovely, beautiful girl. Look how gorgeous you are. You are so smart. You're amazing. Let's help you become the best person you can be. Or the same thing for the boys. Why we need to focus on the healthy children and not inject our nation's children with chemicals and do surgeries on them that are harmful to them in the long run, especially when they're pediatric patients and they really can't make their own medical decisions for themselves. And now with increasing legislation, we're taking that ability away from parents as well. So this is getting to be very terrifying. And I think back to your original question, I'm not sure if you had a question or more of a statement, but yes, we need to know what anatomic body parts someone has as we're making diagnoses, right?
Right.
Yeah, but there was a recent situation that came up in North Idaho, I believe, but it was a family that went in for their child's kindergarten meet and greet the teacher, and they were asked to list their child's pronouns on the kindergarten intake form. And this was in Idaho. Why would we do that? Again, these are extraordinarily rare to have a child identify as transgender on their own volition. I would say it's
Right.
impossible at the age of 5. It's just not possible. They barely know that they're a boy versus a girl at that age. So
Or do they care at that point?
exactly,
Right. They don't
right.
care.
But if we look at evidence and we look at data, we clearly have data now showing that up to 20 to 30% of some of our nation's teenagers now in certain areas are identifying as gender questioning. 20 to 30%. And I've talked to these young people in the clinic, and I've had siblings come in and they both want to change the opposite gender. And I've said to them, I said, tell me why. Why is this happening now? Why do you want to do this now? And they're very open with me. They say, because all my friends are doing it.
Right.
I have friends who are gender queer. I have friends who are gender questioning. I have one who's transgender. I want to be like them. It's peer pressure, pure and simple for the vast majority of these kids.
Well, and you got to really question, I mean, where they learn it. I mean, you were talking about the 5-year-old. I mean, obviously they can't make a decision for themselves or like Janet says, even care. But you got to think that it's, it's not coming from the kids. I wouldn't think. I mean, it's coming from the parents. And part of it is that, at first, as a society, we accepted that it was okay to question your gender. And then we tolerated it. Then we accepted it. And when you accept that and you don't question it, and I get it, I'm not a doctor like you are, a pediatrician, and you have to talk about this in a loving way. I get that, but we can't accept it as normal. I mean, it's not normal to change your sex.
That's right. Yeah, we've been so politically correct. We've been so polite as a society that people have not been speaking out when they needed to be. And I get it. It came from a place again of trying to be kind and accommodating and loving, but it has completely morphed into a situation where without doubt we are absolutely damaging the emotional and physical health of this nation's generation of children. This generation that's coming through the school system right now. We are absolutely harming them. I've seen them in my office. We are destroying this generation with this idea that you should inject yourself with chemicals and have surgery to somehow become something that you will never fully become. I cannot miraculously change anyone from one gender to another. Neither can you. No one can do that.
No,
Right.
no, that doesn't matter. It doesn't matter what surgery you have. It doesn't matter what drugs you have. I mean,
Correct.
and you can see them. The males that have went to trans female, they still look male. I mean, you can tell they look male.
Yeah.
I mean, there's just certain characteristics you cannot change, especially if you've let them go through puberty. Now, changing them early on is probably even more drastic, and just I even hate thinking about it.
Well, I'm going to make a comment here because, when I think about parenting my children and Shawn and I raised 2 boys. And sometimes you learned as a parent not to overreact to what was being said or what, because you didn't have the whole picture.
Yeah.
There were times where they were just emotional or they were just upset and you revisit the situation. And I remember, like, I think it was junior high, my oldest said this teacher didn't like him and didn't want him in his class. And so we had the conversation and I got to the answer. And what it was is the bell rang and she didn't have a chance to ask him how his summer was.
Yeah.
And he was totally upset with her. And I said, the next day I said, well, how was school? How's this class? How's this teacher? He had moved on. It was over. He didn't feel rejected. And it wasn't, part of it, I guess, as a parent is I could have made a big deal about it, but we just kind of checked in. How was it going? And really what I learned from that was that day he just felt left out.
Yeah.
And the next, by the time he probably was into the next day, it was all solved and done, and he moved on, and he learned from that too, right? He
Yeah.
learned that perhaps his emotions were overreacting, right? I mean, he moved through something, right? And I could have went to the teacher and probably made it a big deal, but why? I mean, there's so many times as a parent that you just kind of have to listen and decide, and whether, I mean, even toddlers, how many times are they upset about something and the next day they're not afraid of anything, And it's like, it's just moving on and developing. And as their brain develops, things change. So I, mm,
Well, I think physically too, especially with boys, I know I couldn't make a very good decision, and maybe I still can't. But even into my 20s, and I can see it with my boys how much they have gained intellectually in their young 20s. I can't imagine them making life changing, physical changing decisions on their body parts when they're even 18, let alone younger than that. I mean, because I would think that they would regret it.
Yeah, I think it's, we need to let our children be able to explore and figure out who they are. That's a big part of their development, right? In their childhood, is exploring and becoming the people they're going to become. That's so important. But to make physical changes with them and to inject them with things that are irreversible, once you've been injected with a product, you have all the potential side effects of that product, bone density issues, changes in voice, there's so many changes that are those are more permanent, right?
They're irreversible, right?
And so allowing them to make decisions, allowing them to wear clothing that they, identify with, that's all fine. That's all part of a normal growing up adolescent type behavior. But anything permanent or surgical, and especially having a government then intervene and take away parenting rights, is just, it's terrible. It's really terrible.
It's scary.
To contemplate that we're letting that happen in our society and we're not standing up to it. A lot of people are standing up to it, but we need more voices. We need more people to stop being so politically correct and start standing up to this outrage. Mm-hmm. Yeah,
I agree. One of the analogies that you gave was, to make it more black and white. I think what we need to do is give an analogy. And I know when we had you on our podcast before, you gave the analogy that if somebody came into your office and they said, "Well, I don't like my arm. I want to cut my right arm off because it's evil or whatever." You kind of made that analogy with body parts, and I think when we make it that, we get away from the political side of it and the social side of it, and we make it more black and white. It looks like we're having some problems getting Dr. Renata Moon. She's going in and out. I think it's probably her internet issue. So I don't know if we're going to be able to get her back on.
I'm back.
There she is.
Sorry, I'm having some trouble with where I'm.
That's okay. That's okay. It's
I'm
technology.
Having to flee a little bit. So I think I try to. It's important to think of this sensibly, right? So if someone came into my office right now and said that they wanted to cut off or amputate an extremity for a child, would we do that? Of course not. I think we all vehemently would scream and say no.
Right.
This doesn't make any sense. Of course that would be outrageous. Why would we do that? We're endorsing this is crazy, right? So why are we saying that it is, without any discussion or debate, why are we saying that it is somehow okay to permanently remove the genitalia of children? It clearly is not. It is in the same. These are children. Once you're an adult, you can make the decision that you make as an adult. That's a separate conversation. But we're talking about children here. Children who don't have medical decision-making capacity. And now you're trying to have a government take away that medical decision-making capacity that normally would fall to a parent, a kind, loving parent. Carte blanche, they're trying to take that away from all parents. Of course, there are some parents out there who are abusive and don't have their child's best interest at heart, but the majority of parents love their children and they have their best interest at heart. And so how is it that we're allowing this to happen? And we need to just resolutely say, no, this needs to stop. And we need to have dialogue and discussion around it and be loving and kind to one another. We're all Americans. We're all in this together, but we need to have dialogue. And silencing the people who are concerned about the safety of our nation's children when it comes to this issue is obviously the wrong answer.
Yeah, absolutely. And so, what is your thought, Dr. Moon, on how do we stand up, especially as parents? Talk about from a parent side and talk about it from a healthcare professional side.
Yeah, I think unfortunately the healthcare professionals are very trapped in the system right now. So we have employers basically telling us that we have to ask pronouns, we have to do things a certain way. They want healthcare professionals walking in lockstep with one another when it comes to medical decision making and when it comes to very controversial issues like this one. That is a huge problem in and of itself because a lot of physician colleagues and a lot of other healthcare professionals besides physicians are, they feel like-minded, but they're afraid to speak out because they will lose their jobs, they will lose their ability to pay their mortgage and to feed their families. But we all need to start speaking out because the reality is this comes down on us. If more and more of these laws come down on us, and they will, and they restrict everything that you can and can't do for your own family and your own children, ultimately you're going to lose your freedom anyway. So, and then you won't have any say in it. So right now is the time for everyone to speak up and be brave. America, land of the free, home of the brave. It's time to be brave so we can stay free.
I love it. I love it.
And that's where we are. Now, as far as parents are in a very tough situation. I get that. Their kids are being pulled by peer pressure at school. They're being, they want to gender affirm to a different gender, as they put it, because they're primarily because of peer pressure. We didn't have this many children doing this even 5 or 10 years ago, right? 20 years ago, when I first started practice, I sent a child to a child psychiatrist maybe once or twice a year. And now, we have children seeing psychiatrists every week. We're referring them in the clinics. The mental health of our nation's kids is not good. But the best thing you can do as a parent is to be available for your kids. It's to have those long, difficult discussions with your kids, tell them that you love them, show them the right way to do things. Yes, they'll be pulled in some directions. If it's, there are plenty of girls who traditionally were tomboys and, and that's perfectly fine. Go do a lot of the things that the guys do. Go wrestle, go play football, go do all those things. There's no reason that you should be restricted in that, but leave your anatomy alone and just be a wonderful human being that you are. Be the wonderful human being that you are. Why would you change anything about your body? Why would you do that? And so have those hard discussions with your kids, help them to see how unrealistic and crazy this has become, and help them through this time period by encouraging them when you can and being supportive when they're harder discussions, But have those discussions. Don't ignore them is my point. So yeah.
Yeah, absolutely. I always appreciate you being on. As we wind this podcast up, Dr. Moon, I just want you to sum up in a couple sentences. What do you have a passion for?
Well, I have a passion for freedom, as you can tell.
I love it.
I have a passion for our nation's kids. And unfortunately, that has crashed into itself in the last 3 years. I have seen this country, from my vantage point as a pediatrician who practiced in Washington State, I have watched the mental health of our kids just be destroyed. We have just destroyed the mental health. It had to do with our cell phones. It had to do with social media and all these horrible things coming at them, inappropriate apps, teaching them about things, sexual behaviors they shouldn't know anything about when they're little and 6 and 8 years old. Terrible things. I've watched those two things crash into each other. We have and are still in the process of absolutely destroying the mental health of our nation's kids. And it's only when all of us are just link arms together. I don't care what side of the political spectrum you're on. What matters is the health of our nation's kids. So we've got to have freedom for all of us to make good decisions. Silencing other people is never the right answer, ever. And right now your physicians are being silenced. Your own voices are being silenced. And the way we stop that is that you start right now as an individual who's listening to this, you start speaking out against this. Be brave, be strong, be firm, be loving, but stand up against this and speak out against this. We turn this around together, all of us. So.
Absolutely. Yeah. So, Yahada, we have a comment. Let's go ahead and stream that comment. It looks like Dr. Sam Madera agreed. Needs to be discussed openly. Like the more, sorry, I get close to the screen to read it. Great podcast. Thank you, Dr. Moon and Shawn. Well, thank you, Dr. Madera, for watching, and thank you for fighting for freedom too. Because like Dr. Madera, I'm all about liberty and freedom. And anytime a government steps in and wants to take any kind of individual liberty from us, it is not good. And when they say it's for the greater good, be scared,
We really,
because be fearful, because that is not true. That means they're going to steal your liberty so they can control you. And if that is not clear what's happened the last 3 years, I don't know what would make it more clear. I can really thank my wife, because from day one with the COVID thing, when they started the lockdowns, from day one, I said, "Oh, Janet, let's just, it's 2 weeks to flatten the curve." Janet looked at me and she said, "Shawn, this is Nazi Germany. Get in the train car." From day one, my wife didn't believe it. And we need more people like her, and to stand up and say, "No, this is not what we are going to tolerate."
Yeah, I agree.
So, Dr. Moon, thank you so much for being on our podcast. I really appreciate your information. I appreciate you fighting for liberty, because it's not a selfish thing. This is for everybody else. So everybody else can have a choice too. It's not just about you. It's not just about me. I'm fighting for everybody's liberty. And if somebody wants to,
Yeah.
have choices, that's what I'm fighting for. So
Yeah, I fully agree. We're doing this for every last one of us, regardless of any. We're all Americans together. We're in this together. So yeah.
Absolutely. And coming from communism, you know exactly how this works. So please, people that are listening and watching, pay attention. She's seen this stuff happen. Please wake up. So
Yeah.
thank you, Dr. Moon, for being on our podcast. And I look forward, and people, save the date. On 9:30 on September 30th. Will you go ahead and put Dr. Moon back on? Dr. Moon, so you're back on. So on September 30th, we are having a medical freedom conference in the Pacific Northwest, and you do not want to miss out. We're going to have some great speakers, along with Dr. Moon, a great speaker herself. You do not want to miss out. 9:30. We're going to either have it in the Coeur d'Alene, Spokane area. We're finalizing the details on venues right now. So save the date on September 30th. You don't want to miss out our Medical Freedom Northwest Conference. And listeners and viewers, thank you for tuning in today. Dr. Moon, thank you so much. Health Solutions with Shawn and Janet Needham. Thank you for tuning in.